Welcome to another Doctors Express Medical Minute.
Hi, today's Medical Minute will be on concussions and head trauma, in particular in children. So this is a topic of interest, unfortunately. Many of us have kids, they play sports. Many of us are aware of some of the lawsuits stemming from the NFL, the National Football League, where players over the years have had recurrent head trauma and concussions, and some of them, unfortunately, have developed brain damage, and some of them, unfortunately, depression, other mental illnesses, and have actually successfully committed suicide, like Junior Seau. So it's a tragic thing. And hopefully some good can come from such tragedy, and so we're trying to educate folks about the dangers of concussions and what kind of head trauma and brain damage can occur. So actually, in recent months, the Connecticut Assembly, the House of Representatives, passed a bill to mandate specialized education of sport athletes, their parents, trainers, coaches, and they may even extend it to providers, but to make sure they're aware of all the dangers and the signs and symptoms of head injuries and concussions. So in terms of the clinical examination and what is the provider, the physician looking for? Well, the first thing is they have to talk to the patient. Did you lose consciousness? Were you hitting the side of the head, the front of the head, the back of the head? Any nausea or vomiting? Any amnesia, either retrograde or anterograde? Meaning you can't remember things before the head trauma, or you can't remember just after. Those can be concerning. Then examination. Is there a lack of coordination? Do they have a normal neurologic exam? Do they look lethargic or fatigued or out of it? Are they answering questions appropriately? Can they do simple math? Those sort of things. If both the history and exam are relatively reassuring and normal, then I'm happy to say the vast majority of patients do not need a head CT, a CAT scan, or an MRI. Okay, that's a big question we get from parents and students and athletes. So the vast majority can be reassured, watched for 3 or 4 days, watched for increased lethargy, confusion, sleeping more than normal, those sort of things. And if none of those symptoms develop, then of course they can return to sports in a matter of days. There is no set time. You can't say 3 days a week. It's an individualized thing. So you have to examine the patient and talk to the coaches and the parents and that sort of thing and come up with a plan as a team. So in a perfect world, of course, we want to prevent concussions. So this is what some of the legislation is geared towards. Of course, we all want to use common sense. We want to use helmets if we're playing contact sports. There's a lot of headbutting, so, actually it's not just contact sports. You always think of Australian rugby or football with all the head injuries, but really soccer, basketball, you can see it in a lot of other sports. Of course, you're not going to see it in golf or tennis or baseball too much. If you're driving, parents, of course, no driving under the influence, that sort of thing. Kids always wearing seatbelts. If you have an older person who lives at home alone or even with someone, you want to do safety precautions to the house. You want to make sure there's a safety bar near the toilet and the shower, those sort of things. So prevention is key. So here at Doctors Express, this is a topic of interest to us. We're trying to become a local center of excellence in caring for and preventing concussions. So if you have any questions, of course, come down and see us right away, and we're happy to help.
This has been another Medical Minute from Doctors Express Urgent Care, with locations in Danbury, West Hartford, Bridgeport, Stamford, and Hartsdale, New York.